So we're going to keep talking about article construction uh, and some tips of how to make it better. So one of the questions actually was, it must be the first, oh, okay, I have to get my pointer back, my laser pointer. I like this. It must be the first disclosure and contain sufficient information so that the author's colleagues can evaluate the observations made, repeat the experiments, evaluate intellectual process. It should be available to a scientific community without restriction and available for periodic review. So one of the questions was in the previous talk, if it has to be something new. Yes, it has to be something new. Even if you analyze data that existed, you are giving it a new interpretation. You are going to reach different conclusions than previous articles, even if your data that is already being analyzed or shared to others, or you're doing epidemiological studies of things that are known. By doing this study, you chose some new angle to the problem or show different light. So that's what we consider new finding, right? Why did you did this article, and what did you find that was different from other articles that have been published? So the structure of original design, I showed it as a pyramid, as an envelope, but it can be shown like this: title, author, institution, addresses, and keynotes go at below the title. When we've all read scientific articles, then we read the abstract, and then we read the introduction, and at the end of the introduction is the objective, or what is it that we did. Sometimes, more usually, what is that we found. Then after the introductions, methodology, results, discussion, and conclusions, and recommendations as well. And at the end, the acknowledgements, let's say when you acknowledge the funding source and collaborators, and there is conflict of interest with the financing. If some companies financing for you to test a drug, you disclose it here. And then the bibliography, that's how article we read. This is the other interpretation of the same: introduction, method, result, discussion, acknowledgements, and etc. We already saw this figure. The original article is published in a linear structure, but you should not be written through a linear process. You don't start writing the introduction when you write an article. And this is where we're calling the tree of arguments that we're going to practice to do today. So when you are publishing a data article, a paper, we assume you already analyze your data and reach your own conclusions. After we talked in the previous lecture how you make a list of the data you have, tables, and results that give you a story, that tell a story that is enough for an article. So when you start writing it, you start from the conclusion. As I was saying previously, was the new finding? What is that you concluded from this study? What was the main important thing? And then that's how you start. And then you're gonna go to the results that are gonna prove in this conclusion. The results is the center of your article, and from here you're gonna then analyze the methodology, and then after the results you're gonna discussion of what the results mean, and at the end you're gonna do the introduction. And why is this? Because we usually start writing the introductions. Introductions could be very long, and we sometimes, not all of you, get lost in introducing the whole topic. But like an example I always give is the tuberculosis. You introduce tuberculosis as one of the main causes of death in the world, or you can say the COVID epidemic is spread largely, And then you're going to study an aspect of that. And you're going to switch the introduction after that first sentence or the first paragraph that is going to have a reference. You're going to say, and then drug resistant tuberculosis is a serious problem. Um, and then in the introduction, you're only going to concentrate in the drug resistant, some aspects of it related to what your study is, to the drug resistance in tuberculosis. You're not going to be talking about tuberculosis in the world, in the different countries, what happens. No, you're going to narrow down your introductions to 5 paragraphs max, where you share the general knowledge, then you share what has been found in that particular focus point, and then what is it that is not being done, and what is that you're going to do. So that's, or what is that you did. But since we're analyzing our conclusions and our results, we're going to have clearly what we're going to discuss after the results, and even more clearly the introduction that goes hand in hand with the discussion. Um, so we're going to do this exercise, and we start with the main point or global message, the important new data that you found. The main message found in your research, what is novel, what is interesting, what is the new finding. We are repeating ourselves on and on. And then it's going to be done in 3 messages. If you have 3 messages, message 1, first finding, first message of interest of your research, prevention, community policy. What is it that you found that work? Like in the example of the malaria, the bed nets prevent hospitalizations. So here you have different findings, different experiments you did to prove, sorry, uh, what was that you did, what the intervention you made, what was found in the community, what new policy you analyzed. And in the third message, it also be of interest to your research. If you don't have 3 important findings to support your main conclusion, you might not have enough for an article. You have to have at least 3 messages, 3 main findings that support your conclusion. You can have a little bit more, but if you have like 6 messages that support your conclusion, then you have enough for a second article. So do not overwhelm articles with a lot of information. It's better to limit yourself to a particular message, to a particular finding, and that you have proof in different ways, by different ways of seeing it, by molecular biology, immunology, epidemiology, case control, what different things made you support that this main point is true. And I'll have some examples at the end. And then this is arguments or evidence. So here, this is the summary of the result, evidence that the main messages that you found. This is how you did it. So we can say that bed nets to prevent malaria were proven in this community. And then here you say how many people in the community you found, and this is your results. This is your tables. We found this percentage of usage. We found this percentage of people with Zika and brain malformations or brain defects. We studied, well, this will be the main message. And then we studied these many patients that show um, brain damage by studying this way and this way, and here's our data. And the same here. So we have 3 arguments, 3 sets, not just a simple result for each, but 3 sets of results for each of the messages that we're going to present. This is our results. This is the first paragraph of the results, and this is the beginning of our thinking process. So if we organize our article like this, it's basically written by itself, because we would say we discovered this particular point, this particular new finding. This population, have higher incidence of Zika infection than others, and then it has more because we tested this other, and we proved that furthermore there's more data. And then what populations we studied, how we got to these arguments. So this is supporting the evidences here. And after these arguments, which is our results, we are going to write the methodology for each. So we have the article written, um, the meat of the article written, the results, and which prove to each result, the second result, which prove to each result, and the third result. And we can summarize it this way. And then if it makes sense and it has a clear new main point that we're showing, then we start writing by starting with the results, because that's the most important part. So we analyze the tables, graphs, figures that we have, and we explain each one when we're going to write. So it has to be well supported. My arguments are well supported. Do we have enough data to prove each point? This is going to be the center part that you have to work on your article. If you have your article already written or very advanced, just do this exercise for fun, just to prove that the main result that you're talking about is in a relevant point, and that all the different results that you have, a specific individual result, support this idea, the central idea that you want to convey to the reader. And that you have enough proof, enough data to support what you started with. So then, as I was saying, then once you reach the conclusion, where you're not going to write it in the article, but you could at the end of the introduction, you start writing the results. And then after the results, same. What is the first, the message, the important messages, and the evidences that I have for those messages, and are they well documented? They are well proven, they are well expressed in tables and figures. And then we write the methodology because we know what we did, and then it relates to those results we chose to present. So sometimes we have many results and we don't know which to include or not. When we do the three arguments, at least three arguments, but it could be a little bit more, but not less, then we are going to add write the methodology in the order that we write the results. That keeps the reader, it could be in the same, it's advised, but sometimes it's not possible to write the methodology in the same order that we did the results. And after the results, we can discuss what we found. So again, we write the methodology based on these three evidences that we have, and how we reach, what experiments we did, and how to reach these three different arguments or more. And then we go to the discussion, like I was saying. So now we have clearly written our results in our mind. We know what we obtained. We have the methodology summarized, because sometimes we have methods where we have results that we're not going to include because they are not relevant, or best relevant, or more important. We're going to narrow down the methodology. But anyway, then we have written the results and we can discuss all our findings. We'll have it fresh in our mind and it will be clearly, and then we contrast it with the literature, or what people found or not found. Is the same, is different. And then we move to the introduction. How what we discuss here is what we will introduce, or the introduction sometimes have more data, different data, but it's going to be focused in our findings and in our results that we have. And our main conclusion is going to be linear. It's going to make sense, because at the end we're going to start here, but we have already analyzed and select what's important for the introduction in light of the discussion and the results. so that we can compare with other articles and we don't lose the reader and the reviewer with a lot of information that is not relevant to our topic. And then at the end, the keywords, the abstract, the title, at the very end, because it's when we have written the paper, we now know how we're going to present what we're going to present. We have a lecture on the abstract, and then we're going to have keywords and a good title that is going to attract the reader, the editor. What in the title, it should be what is new. Many times we give a title that is characterization of population that has infection with Zika, and it's kind of boring and generic. So instead, we can have a title that said, "We found that Zika patients have increased characteristics in such and such." That could be our title that calls to the new, interest to the editor for the magazine, and interest to the reader once it's published. So we're trying to convince and tell a story for others that, and we have tried to make it exciting and new and clear and easy to write. And then the acknowledgments, conflict of interest in financing, and bibliography. That's so somebody was asking how long each part should be. It is a general recommendation. The abstract from 250 to 500 words, sometimes 500, 400. It's usually 300 is what they require for an abstract. So, sorry, this is the title page. This is just the introduction of the authors, their addresses, title, etc. The abstract, usually 300 words and 3 to 5 keywords. The abstract is going to be indexed separate from your article, and it should have keywords. It should have the important information. It's a mini article, and we'll talk about it later. And it has to have the keywords. It does not have references. The references, the reader will have to go to the article. Introduction, 700 to 1,000 words. The shorter, the better. 700 words will be better, 800. Methodology, 3 to 1,000 words. Results, 500 to 1,000 words. And discussion is the most, 2,000 words up to. Because this is where we want to spend the time interpreting our results, explaining why it's important, why it's new, why it's relevant, how it's going to contribute to the general knowledge of science, but a particular field, how it's going to start policies or support policies in our country, in our department, in a particular topic that needs intervention. This is where we're going to express our interpretations and the needs and the recommendations to do to that we presented, that we discovered that our findings. So this is our chance to sell our article and to explain the relevance compared to others, and uh, summarize, not repeat the results, but kind of emphasize and summarize what are the main points that we found. We don't repeat the tables and figures, these many patients were studied, but we say the tendency or a study, we found there is a trend that can be seen increasing or decreasing or higher incidence or elements that we found that are essential. Acknowledge reference and tables. Anyway, that's just a recommendation of how an article should be, but it's very important that you look at the journal that you're going to choose. And tomorrow morning we're going to do a selection, how you can choose your journal. It will tell you how long it should be. It will tell you how to write the abstract, the title, the introduction. Sometimes the methodologies have subheadings, which is very helpful. Also the results with subheadings, which is very helpful. Sometimes even the abstract has subheadings, but not all cases. And how long is the discussion? And we can see if our article fits in the guidelines or the interest of that journal. So this is some examples of 3 of arguments. This is a simple study done in Colombia. First report of non-transmissible mycobacteria in drinking water in the city of Cali, Colombia. It's the first report of the presence of mycobacteria in the drinking water. So that's kind of like something that sounds important for the reader to know. So non-transmissible mycobacteria were isolated from drinking water in the city. That's one of the arguments. Characterization of the potential pathogens found in these mycobacteria in the drinking water. Characterization of water plants, and how many water plants had this infected bacteria, infectious bacteria. And here's the evidence, the results that took us here. Mycobacteria was isolated in 9 of the 18 sites tested. 36 samples were analyzed and were positive. This is going to be a chart or a figure in the future. But we started the results by summarizing what we found, and then we describe it in tables. 5 species of were isolated, table 2, and we classify as fast growing. And here are the most frequent mycobacteria found. And here the analyzed database for the weather season, geographic sector, type of house, treatment plan sampling, and each point was recorded. So they did image sampling to reference which wells were more contaminated than others. So it's a little simple experiment that could guide you to your articles to do this kind of mental exercise or written exercise. This is a study made in Paraguay, in where the strengthening favorable to transparency and access to public information and citizen empowerment increases the level of control. This is kind of like more theoretical, where they analyze 5 years of increased transparency in anti-corruption policies, and then they cite the policies and the law. So this is a very different kind of article, but the trio of arguments still works. The law, access information, and pro-transparency policies, and then the creation of public institutions, training of officials, that helped to these policies, or policy implementation and regulatory strengthening are insufficient. So they asked the public, and then the 17,000 requests for access of information were found. So this is a very different kind of article, and there's a couple in the ones submitted that deal with this kind of subject. This is a genetic mutation that some of you have. Prevalence of this mutation, genotypes in African descent with chronic kidney disease, that's the title. And then there is the main point, which is high risk of genetic mutations in Afro-descendant population with chronic kidney disease in Colombia. So it's Afro-descendant people in Colombia. And then 37% of Afro-descendant population has a genetic cause, and then how many patients they study and how they reach to this number. Presence of at least this mutation allele, and then what genotypes they study and what genotypes were found. And then 30% do not have the mutation, but one person had this other mutation. So this is less important evidence, but it's important because of the risk presented for disease. Anyway, you see this example, and then you try to adjust it to what your article you did. This is the same, and here's the blank page for you to do your own study, for you to exercise this. So with the 20 people that we have in the afternoon, we're going to be doing this exercise with the main point of global message, the 3 arguments, and then evidence for those arguments that you can do briefly, and then you will have very organized your article. And we'll be talking to each of you in the afternoon to clarify what points are not clear, what is it that you should consider, how is the order of your data. Thank you very much. I wanted to say this was translated and adapted by the TDR, the Pan American Health Organization has proposed this, or the WHO have proposed this sketch to help people organize, and they sequestered the teams for a week, and at the end of the week, they had finished writing the paper, the article. So that's what we're attempting to replicate for you to by Friday have a draft. So those that are not full participants in the afternoon could start making their exercise and reviewing if your article makes sense and if it deserves to be published. Okay, thank you. I'll stop here.
Thank you, Maria Elena. I think we can go for a few questions now, and I can read them for you if you prefer.
Okay.
So we have a few questions about this topic, and I will start with this one. Can we make argument 3 for an exploratory study as well?
Yes, as I gave some example, the 3 helps you organize any kind of a study. So you write mainly what finding you expect from this exploratory study, or maybe you already did it and you can divide in 3 arguments what your study findings are, or you propose to find.
Okay, here I'm going to, so it's a question by Natalie and Cristiane. It's 2 questions. I'm going to make it into one, which is, what are the main differences in structure in a review article and also in a case report or case series study?
Okay, yes, there are different structures. For a review article is very different because you don't have a main point. There will be several main points, so a tree of arguments wouldn't apply in this case. A review article is very different, and I might have an example that I could share with you. You do have a main point in a review article that you're trying to show a particular trend when you review something, an increase of a disease or problems with this particular disease or this particular topic. So when you do a review article, you're going to have some kind of main conclusion you want to reach, your main points that you want to show, but it does not follow a trio of arguments as was presented here. The other one is a case report. It can follow this same structure. A case report could be one case, could be several cases of a disease. It's feasible to do a trio of arguments. It's the same. You follow the same scientific order. This is what we found. This is how we found it. These are the evidence to show this, and it just be a very simple trio of arguments because it will have few findings and it just pointed to us. I don't know the case, but it'll be a little different.
Right. I apologize in advance if I pronounce any names incorrectly, but there is a question from Gilda. The question is, what if I don't find any other studies, literature, that I can contrast with one of my results? How do I present it in the discussion?
Well, if there's not really data, that is precisely your argument then. If there's nobody that done this studied, you have to show and say the literature has done similar or other topics, but not this particular one, or you're doing a very localized study where it's never been done. You do have to justify why you're doing this study. Your justification could be doesn't exist data on this, and it's important to know. So you have to convince the reviewer why it's important to do this and that there is nothing known. there could be, there's got to be other cases where maybe this had been analyzed, or any general idea of how this is done. So that would be the references. But then you said it's never been done and it's nothing to compare with. And you just explain that this is totally new or different.
Right. Another one is, when should we think about a title? Prior to start writing, or at the end of writing?
At the very end of writing is the last thing you write. The article has to be exciting, has to have your findings, your new discovery, whatever it is that is different that you're publishing. Don't write articles that are generic, like characterization of these patients in this clinic for some mutations to see they're present. That's a little bit a boring title. And that's our working title. That's our working project that we did. That's valid. We can have working titles all through the article. As we do our main point and the important arguments, we choose one of those to be our main title. So this article shows incidence, increase of incidence of this disease and consequences of mental damage, or um, different topics will have, but it will have already the finding in the title. And that's what makes you be chosen for review, and that's what excites the reviewer at the beginning. When you read it, oh, they found this new thing. Let's find out, let's read more about it. The title is very important. It's the first thing they see as well as the abstract. So we write it last, and we try to make it exciting, but all along we can have working titles that we are modifying until the very end, where we are more inspired, and then write an exciting title.
Right. Have a question here from Nadira. She asks, can we cite newspaper findings as supporting evidence in case of new findings not done before?
If the new findings are published, you cite. If they are not published, you say personal reference, non-published information. You have to state it that this is a non-published information that has been experiments that have been done. So you have to say, we're going to do this and that because so-and-so found not published information, in parentheses, this and that and the other. It's not advised to do it much, because the reviewers have to have references for you to make sure that what you're reviewing is correct, and they will review those references. They will check few of them. Usually the reviewer is in the field of what you wrote. So when the reviewers are chosen, they are chosen because they work in the same topic that you're presenting, and they know the literature. Another thing is important here is you have to have the latest literature review at the time of publishing, because they check the latest literature when you are presenting a topic. And if it's not the latest, and if you have not included all the new findings up to date when you publish, so you do another literature review at the time of publishing, the editors are going to find out that you omitted data that is relevant and important to your findings.
Thank you. I think the question was also about, for example, now I'm just guessing here. Now
Yes.
with COVID, we have in the newspapers some news on the number of deaths, the number of cases. So in that case, is it okay to cite some piece of data that you found in a newspaper instead of a scientific journal? How do you do that? I think that's a question.
No, you don't. No, you don't. There's a lot of report in the papers. There's a lot of report casually in podcasts. You have to try to find the article that published this. Usually these reports, these news, have a publication that is coming or is come. Yeah, in a scientific article, you have to have backup of what you say is true. There's a lot of published in about this epidemic. I know the latest, usually when they talk, sorry, excuse me. When they talk about the latest information, it's because an article has been published and we just don't know about it yet. So try to find that article. But just hearsay, that this vaccine is working better than the other one, or that the number of cases is really high in Brazil. We have to have some sort of data, even if it's public health data, the public department, public health department that has some sort of record so we can put online. If we did a search online and this is what the health department is saying or recommending, then we cite that. We said in the website of the health department was reported this and that and the other, but it has to have some basis. It cannot be things that are published in newspapers, that are talked about in Twitter, in podcasts, in YouTube. That is not acceptable for a scientific article.
Perfect. So there is another question here, more focused on the tree of arguments. So the question is, should the tree of evidence be strictly limited to 3 findings? What if you have more than 3 important findings?
Yes, it can be extended to 4 findings. If it's 5 or 6, I think you have enough for 2 articles, because it's going to be a lot of data proving each argument. Unless you can group a set of data or experiments that are related to the same kind of experiment, if you have 5, 6 different arguments, it's going to be a very long article, and you might have enough data to write a second one. You might decide which is the most important and save the others for others, or you might be able to group them in one same set of evidences on one important evidence and argument. It's not recommended to do 6. That it demonstrated that you have 2 articles to write if you have solid data on 6 points.
Right, perfect. There is one question here. There is a clarification that I think it's important to address. So it comes from Stephen, and he asks, I don't know if I got it right. The evidence is drawn from study results and the arguments from the previous studies. Is this correct?
No, say this again. The evidence.
So he's asking if the evidence is drawn from study results and the arguments from the previous studies.
No. The arguments are your own arguments of your own findings. This tree of arguments is only to do with your data and your findings and your research that you're going to publish. It has nothing to do with what has been done previously. That is part of the introduction and the discussion. This is your results. So your results are a finding that is drug resistant in tuberculosis. And then that's your main argument, that's one of the main conclusions. And then in evidences, you put your data that proves that there's drug resistance, how many cases you studied, how many populations you studied, even if it's just a case report, what the kind of examination experiments you did for that case report. So in all cases, you're talking only about your data, the important points, and the secondary points, and the data that support these points. So yes, the results, the arguments, and the evidence are linked.
Right. I think this also relates a little bit to another clarification coming from Pia. So Shes, if I understand correctly, the tree of arguments helps structuring the discussion session of the article.
It helps structure the whole article. It helps structure what you put in the introduction, the results that you're going to select that are the most important, and the experiments you did or arguments or evidence is the evidences that you support your arguments or your three different findings that you have. And it helps you write the results. Once you have the three arguments, the three main sub messages, you're going to start writing the results starting with the first sub message. You can start with the main conclusion saying this study show that there is increase in resistance or the increase in infection of Zika. To prove this, we did this study on this population, and we found that it increased that percentage. And to prove this, we did this number of studies, so there's the evidences. And that's your tables and figures. And to prove this, we did this, we analyzed this many cases, and this is the table or the graphic that represents. You're writing the article once you have the three of arguments. You write the results, you introduce the results, you write the specific results, then you're going to add the material and methods based on the evidences that you explain, what methodology you use to reach those evidences. And then at the end, you take the three arguments and you discuss them in the discussion. So it helps you write also the introduction, because you're going to focus your introduction and your main topics and your main arguments only. You're not going to make an introduction that it is going to cover the whole field that you're studying.
Perfect. Yeah, I think we had other two questions that are also related to that, if you can confirm, please. So it's a question from Loveling. He asks, first, he says, thank you for the beautiful presentation. And the question is, can you call objectives of the study the argument? So is it the argument, is it the same as the objective of the study?
The arguments are the answer to the objectives, the results. So you set an objective to determine the incidence of a disease, or to determine what's the prevalence, or to establish the relationship between obesity and breast cancer. And then in the evidence you say, we found a correlation of obesity and breast cancer. And then in the evidence you say, this is how, and you put the data, and so on and so forth. So, and then the second other thing you did, that you found that maternal breastfeeding contributes to this or not contributes to this, and then in the evidence. So yes, each evidence is a part of your findings. And it could be the answer exactly to the three objectives or objectives, whatever objectives you set to do. We want the result of those objectives. We don't want the objective itself.
Perfect. So a question from Jonathan, which is, is the tree of arguments effective for qualitative research?
Yes, qualitative is the same. You just put the sentences as one of the examples that I presented, that you're gonna do this data analysis, or you're gonna do this policy making that is not clear, that is not accessible. Yes, it is valid for all sorts of articles. It doesn't have to be quantitative. You just show the data you did and how you organized it. So in those particular articles that are qualitative or exploratory, or about policies, or about other topics that are not specific experiments, the theory of arguments helps you organize your ideas and what is the importance of each, and the order of importance. Sorry, I think I have hiccups. So it helps you determine how they all relate, what is the most important, what I should follow with, etc. I think they're very helpful. It's just an advice. You don't have to do the three arguments.
Perfect. So the next question also comes from Pia, and her question is, could you suggest any other framework other than the tree of arguments for writing a review article, please?
No, I don't have it right at hand. I don't know if my colleague Stephen or Gregorio have written review articles. I have examples of review articles which I will bring tomorrow for you, and we'll share it so that we're going to make these talks public and available to all. So we can start tomorrow talking about review articles, because I see there is several interests on how to write a review article.
Thank you. Question from Safa. Can we publish data from a study done 10 years ago? And what about the literature review?
Yes, you can publish data about literature, all data. We published an article in Leishmaniasis 7 years later. The data is old, but it has to be relevant today. You're not going to publish all old data that it doesn't have some importance, that people should know this, because it's important to know more about this particular disease study. So it has to relate to the present somehow, and say, since we did this study in 2010, there's no new findings on this disease. There's literature review we've done exhaustively, and there's this other article and this other, but we consider it's important to know that this exists, that this data is relevant. But if it's a topic 10 years ago, it has to be some sort of similar cases or follow-up up to date to that case, so that it has more relevance. If it doesn't contribute at all to the present status of things, then it is not a great help. But it is valid. We had a data on leishmaniasis from Nicaragua for now 10 years, but it's published 7 years later, about the immune response and the cytokines, and nobody else had done it, and we thought it was very important to publish. And it was very relevant today, because no studies similar to those had been done, and there were references that could be found on the topic. I don't know if Stephen Popper had a comment.
Stephen, please, if you want to comment anything, you can unmute yourself, and the same for Gregorio.
Please share your experiences if you want. And Stephen has a lot of experience in publishing. There's Stephen, but you're still mute.
Hi. No, I just was answering in the chat about the question about using the tree of arguments for a review article. And I think it's still a very useful framework, because it's still important to identify, main messages, and then in this case, identify relevant literature that support those messages. And even in a review article, you're still creating something new, because you are creating a new synthesis of existing findings.
Yes, we agree. I just wasn't sure if it was, the structure will be similar. Gregorio, you have a comment?
Yeah, whenever I wrote a review article, I also followed the same logic. You need to have the main messages, and you need to see how new those informations are. So you can actually try to sketch the idea of your review. Why is your review relevant? Why do we need to write a review about that certain topic, and why would people be interested in that? Why is that topical? So making the tree of arguments happy to answer those questions too.
Fantastic. Thank you both. Very important.
Great. Thank you for joining the discussion as well. So a question from Leah. I saw somewhere in your slides that for a scientific paper to be published, the experiments have to be repeated. I seek some clarification on that.
Oh, okay. Not repeated from previous articles, but the way you explain, you write material and methods, the methodology that you use has to be described in such detail that the reader, somebody very interested in your topic, will be able to replicate your studies and find the same results or similar results. So it is just to call on attention how detailed your methodology has to be done. Also, when your methodology is widely used, you don't have to explain in detail, but you have to say, we use this immunology technique, let's say ELISA, which is highly known, to test antibodies, presence of disease or response. You don't have to describe it or cite it because it's well known and there's very many different. But when you are using a methodology of a new monitoring tool, something that is new, you said, we use this monitoring tool and references to populations that uses this methodology, and you cite the methodology, but you mention it. If it's totally new, you repeat it. Or if you're doing an experiment and you said, we use an ELISA as described, with this following modifications. So we use a PCR described by, Steve et al. With the following modifications. So you cite the methodology that had been done, explaining what it is that it was used, and then you explain the changes you did. So everything, when you explain material and methods, it should be so clear that somebody in the laboratory could replicate your experiment. That's what I mean. That's what it means in a scientific article. That's very important.
I do have one comment on that as well. When it comes to reproducibility, reproducing your own findings is not only important that other people can do what you've done, but of course, it's really important that you publish something that you can reproduce yourself. So meaning for one experiment that you want to show an evidence of something, it's really important that in the lab, you are able to reproduce those findings 2 or 3 times. Some journals, they really require you to show, for example, you do the experiment 1, 2, 3 times. Some in the past, people used to show one figure that was representative of all 3 different experiments. But nowadays, some journals, including really high impact journals, they want you to put all the data together from all 3 different experiments. So you have a representative figure from all the data from all individual experiments you have done. And you have to state in the figure legend that the experiment was done at least 3 times in a different way, and not different way, sorry, at least 3 times with technical triplicates or duplicates, and you have to state exactly what you did and how you did and what that figure you are showing is representing.
Perfect. I didn't know that. Thank you.
Thank you. This is a question about methods papers. So does the tree of arguments, sorry, it's from Shakuntala. And the question is, does the tree of arguments apply to a paper describing a bioinformatic tool that can be used to perform some specific genomic analysis? So I guess the general question would be, does the tree of arguments apply to methods papers as well?
Yes, of course. Your main conclusion will be, we introduce this new methodology. Of course, in this particular case, you all have results to show. You will say, we use this new tool to study this particular issue, and we concluded that it is advantageous to use this new tool. It is more applicable, easier, less costly, whatever. And then you put 3 arguments of why you use this tool, why you show that this tool is important, that this new methodology is important. So with this methodology, we tested this particular phase, we tested this other phase, we tested this other phase. How do we test it? And then in the evidence, you say how you tested, how you implemented the new methodology, and how it worked. So we we are interested, the reader is interested in the findings of using a new methodology, how it helped the field to have this new method being used and implemented.
Thank you. Another question from Avinav. Can we say each message in the tree of argument comes from each table in the results?
It could be from one table, each table for each argument. It could have tables and figures for argument 1. It could have only a table for argument 2. It could have graphs for argument 3. It doesn't matter how you represent. But yes, usually we start analyzing our data in tables. Do not use only tables in an article. Try to do graphs and figures, and we'll have a talk on that later, tomorrow. But you can start with a table for each and make sure that you have the data to support the argument. And then you can consider later if you can transform some of the tables into figures.
Thank you. I see some of the questions here in the Q&A. Just to tell everyone that I'm not ignoring them, but some of them will probably be best asked in the relevant session, because there will be a session just for methods, one session just for introduction. So on the following days, you can check the program, and I think it will be better to ask those questions at those points. But I saw that some questions were asked in the chat. If you please can pop your question in the Q&A, because I'm not checking the chat as well as the Q&A. So if you want to make sure your question gets answered, please pop it here in the Q&A. While you do that, there is one question that is very interesting, which is, what are your suggestions? It comes from Amir. What are your suggestions if one can't afford publication fees? I have master students with excellent research, but no funding to publish.
Funding for publication is a big problem we all face because we don't realize when we get the funding to carry out our experiment that the high cost of publications, even the journals that are open access, I'm losing my voice, charge for you to submit, and if you have figures and graphs that are very heavy images, they even charge some more, and it's a surprise to us. Looking back, when we ask for money for research, we should always ask for all the future proposal writings people, ask funding for publishing, because publishing is very important. So the agencies that give you funding want you to publish, and they will push you to it. And then also provide the funding, you know, it's up to $500 sometimes are needed. What we recommend is to reach the journal, select your journals early on, and ask the journal of preference that I come from a poor country, or my team does not have the funds to publish this data, and you provide a summary of your data showing how important it is, of course. And could you reduce the rate? Could you lower the charge or eliminate it altogether? You write to the editor-in-chief of each journal and ask to reduce or eliminate the cost, but because you don't have the means to pay for those publications, you come from this country and you have important data to show.
This is a brilliant piece of advice. Thank you so much. So we're wrapping up this Q&A session now. Thank you so much for all the answers. And we will go now to the demonstration of the tree of arguments. So it's now with Gregorio. The floor is yours.
The demonstration of the tree of arguments?
I think that's
Sorry.
Maria Elena.
Okay, no, so I guess the demonstration already happened with those final slides. Is that correct, Maria Elena?
Correct, yes, they were
Yeah?
just examples
Okay.
that I could present again, or just for people to see different aspects of what could be on a tree of arguments.
Perfect, brilliant. So I guess we still have a few minutes, and if we still have questions here in the Q&A, so can we go ahead with the questions? Is that all right?
Please. Yes.
Yeah. So there is one important question here, which is, it comes from Chino Nielum, and it is, what's the difference between graphs and figures, please? Thank you.
Oh, okay. I'm going to have a lecture on results tomorrow, the next day, explaining graphs and figures. Figures are usually linear and involve data that it's depending, the variables are depending on each other. And graphs could be just like bar graphs that you just say this amount of people is infected, this amount of people is not infected, and you compare bars and graphs. They are different from figures, which are usually show a tendency of the results, and you make linear connections. It just whatever, when you choose the journal you're going to publish, look at what kind of figures and data, how they present it, and it can give you ideas. You can even copy a style of graph and charts, and there's many different, which I will show you tomorrow. Is it tomorrow results? Yes. And then you can, it opens your imagination to different ways of representing your data, and it's very exciting. So when you have a table, for example, with a lot of data, and then you say this medication helped, this medication didn't help. If you do figures, if you do a figure showing the dose and the cure, the rate of cure, I will show tomorrow, then that would be a nice figure to have. Try to avoid long tables with data. But if you have few, contrasts that are not linear, that you say this amount of population is positive for this amount of population is negative, then you do bars or charts or other forms of representations.
Thank you. There is a question from Ranjini. Says, can you please share an article or resource to read more about the tree of arguments? So is there an article about that, or another kind of material that people
I
can
will try
go
to find it. This was taken from a workshop that the Pan American Health Organization did on tuberculosis. That's why we have so many examples on tuberculosis. And it was a very complex study on policies that were used to change how the response to tuberculosis state versus private testing. So it was very complex, and they sat and they thought of this, but it has to be written somewhere. I obtained it from what the WHO used in that particular exercise with the tuberculosis sample, and we translated it, and we translated to Spanish by the Colombian team at the University of Antioquia. That's what it says in the bottom of the tree of arguments. The people that actually took the experience and wrote it and made the tree of arguments. It was made an example for this tuberculosis study. And I will ask them, her name is Maria Patricia Arbeláez. She was the head dean of public health in the University of Antioquia. I will ask her if she has the original article or if it has been published, how to, more information about the tree of articles, how it came about, how it was planned, and how it was executed, to give more info. I'm gonna write it down, tree of arguments.
Brilliant, thank you so much. We have a question from Natalie. I think this is related to clinical study protocols. So how to relate the arguments with the goal and hypothesis of your research stated in your protocol. So I guess this is related to clinical study protocols and how to relate that to your arguments in the tree?
It depends on what your emphasis or focus would be. If you are going to talk about how it was done, what is the methodology to study these cases, or you're going to talk about the results after using the methodology. Of course, we want the results of what methodology gave you. But if you want to introduce the methodology and explain it in detail, then you made that your emphasis. We think this methodology is important, and we're going to present it here in these three different aspects of the new methodology. It could be adapted to a tree of arguments. Does that answer the question? I'm not sure. I don't know if Gregorio or Stephen have any comments, but the tree of arguments is to organize the focus and your train of thought of what was important, of what you did. So you already did this technology. You already presented the case findings. You use this methodology and you want to explain how important this methodology was and how helpful it was and how relevant it is, and we want to include it, and we're going to focus on the methodology. Then that's how you frame your tree of arguments.
Thank you, Natalie. If this has not answered your question, please send another one in the Q&A. There's a new question from Oro. He says, I currently live in Manila, Philippines. Data here hardly comes by in terms of obtaining or collecting. So I'm currently working for an organization that does more implementation science research. So the question is it acceptable or appropriate to use the data we collect within our program and external data that we can obtain elsewhere, for instance, from WHO, for our statistical analysis, of course, relevant to the research topic. So I guess the question is if you can include external data into your statistical analysis. I don't know if you can answer this question. It's about statistical analysis.
This is a complex question. You have to have permission from your team that you are leaving to take to another organization to take the data. You cannot just go somewhere else and use the same data. You have to have authorization from the organization, from the team, from the head of the research, from whoever, that you're allowed to bring that data to a new organization and do an analysis on it. That's the first thing. That's an ethical question. And the second thing, you cannot use published data from WHO to do your own analysis, your own statistical analysis. You can compare it, but you cannot make it your own. Stephen, you're muted.
I was simply going to add, Maria Elena, I mean, I think the point you're making is that one, you cannot use it for your own analysis and represent it as your own data. It has to be very clear that you are using data collected by somebody else, and as Maria Elena was saying, it can only be done if that data has been made publicly available.
Yes, very good. You can use that data to compare your findings and say, the WHO found this particular, they did their analysis and found this particular conclusion, and we analyze our data and it agrees or disagrees with the data from the WHO. You can compare your results and cite the data, like Stephen said, and put a reference of what WHO published, but you cannot just take that information and use it to do your own analysis fused with your data. Gregorio, you're muted.
No, yeah, I was just complimenting and I agree with all that has been said, but just giving one example is when you are analyzing data from sequencing from viral genomes, for example, and the sequence of several genomes, there are those that you generate in your study, and then you make clear this data is coming from my study from the virus that we sequence, but you always have to compare to what is publicly available on a CBI website, for example. And whenever you do that, you have to show the code of accession number for those sequences that are not from your study, and then use to compare, because you have to compare with external data that is not yours, is publicly available. That's just one example. For example.
That's important, and you can include those in your tree of your genetic tree or whatever, as long as you cited that you took it from there.
Exactly.
Okay, that's important to know, because there's published sequences that are available to us in the banks, and we have to cite that session where we took them from the website. That's what you're saying.